Hello and welcome. Every year, millions of us head to our annual checkups, trusting that we're doing the best thing for our health. We follow our doctor's advice, we take the recommended tests, and we leave feeling reassured. But what if I told you that hidden within the fine print of modern medicine, some of these very routine tests could, under certain circumstances, quietly increase your risk of a stroke? It sounds hard to believe, doesn't it? You trust your doctor, you do everything you're told, but imagine leaving that exam feeling fine, only to experience dizziness, blurred vision, or worse a few days later, leaving you to wonder what just happened. The truth is, certain diagnostic procedures can subtly trigger spikes in blood pressure, disrupt blood flow, or set off a cascade of events that could lead to a stroke, especially if you're over 60 or managing existing health conditions. Now, please, don't worry. The purpose of this video is not to scare you, it's to empower you. It's so you can ask smarter questions and become the strongest advocate for your own health and for the people you love. Because after 45, it's not just about finding problems early, it's about avoiding the ones we might accidentally create. In the next few minutes, we're going to talk about 5 common medical tests that may carry these hidden risks, and most importantly, what you can do to protect yourself. Let's start with a very common one, the CT scan with contrast. If you've ever had one, you might remember that warm, flushed feeling as the dye was injected. That contrast agent is a powerful tool. It helps highlight your organs and blood vessels, allowing your doctor to see things much more clearly. It's invaluable for spotting issues like cancers, blood clots, and aneurysms. But here's the part that often goes unsaid. For those of us over 60, especially if we're already dealing with high blood pressure, heart disease, or kidney issues, that little injection can put a hidden strain on our system. In some people, the contrast dye can cause what's called a vasovagal reaction, leading to a sharp drop in heart rate and blood pressure that can cause dizziness, nausea, or even fainting. For others, the opposite happens. A sudden spike in blood pressure. When that occurs in vulnerable blood vessels, it can cause them to constrict or spasm, and the risk of a stroke or a cardiac event goes up. A study in the Journal of Vascular and Interventional Radiology found that older adults undergoing contrast CT scans had a significantly higher rate of vascular complications within 72 hours, particularly those with a history of hypertension or kidney problems. Consider this real-life scenario. An 81-year-old man had a routine abdominal CT scan for some minor discomfort. His results were normal, but 2 days later, he suffered a transient ischemic attack, or doctors suspected the contrast dye caused a temporary spike in his blood pressure, which was enough to form a small clot. This doesn't mean these scans are bad, but they need to be used wisely, not just as a just-in-case part of a checkup. So, how do you protect yourself? Before you agree to a CT scan with contrast, have an open conversation with your doctor. Ask, is this scan absolutely necessary for me right now? Are there safer alternatives, like a non-contrast CT or an ultrasound, that could give you the information you need? Be sure to share your full medical history, especially any kidney disease, high blood pressure, or past reactions to dyes. Moving on, let's discuss a test that's often given to seniors, even when they feel perfectly fine. The exercise stress test. On paper, it makes perfect sense. You walk on a treadmill while hooked up to a heart monitor to see how your heart performs under pressure. But if you're over 60, and particularly if you have underlying heart issues, this test can turn from a precaution into a risk. As the treadmill gets faster, your heart rate and blood pressure climb, putting your cardiovascular system under significant, sudden strain. For a healthy 30-year-old, that's usually not a problem. But for a senior with even mild, undiagnosed circulatory issues, it can be like lighting a match near dry tinder. In rare cases, this can lead to dangerous blood pressure spikes, irregular heart rhythms, or even tiny tears in fragile blood vessels, particularly in the brain. In 2020, a study in the American Journal of Cardiology looked at over 1,300 people over age 65 who underwent treadmill stress tests. They found that about 7% experienced adverse events, like dangerous blood pressure spikes or arrhythmias, directly resulting from the test. The highest risk was for those who already had circulatory problems. One of our viewers, Margaret from Ohio, shared her story. At 74, with a history of managed high blood pressure, her doctor suggested a routine stress test. Halfway through, she became dizzy and felt a tightness in her chest. They stopped the test immediately, but the next day, she suffered a mild stroke. Her doctors believe the sudden surge in blood pressure during the test caused a small vessel in her brain to burst. The test didn't directly cause the stroke, but it pushed an already vulnerable system over the edge. The key takeaway: ask your doctor, is there a safer way to evaluate my heart? For many older adults, alternatives, like a nuclear stress test, which uses medication to simulate exercise, or a simple resting echocardiogram, can be safer options. If you aren't having symptoms like chest pain or shortness of breath, it's fair to ask if the test is truly needed right now. Next, let's talk about something that becomes very common as we age: endoscopy, like a colonoscopy or an upper gyroscope. These procedures are critical for screening and diagnosis, but the risk we need to discuss isn't always the scope itself, it's the sedation that often comes with it. Most of us over 60 are on at least one medication, and many are on blood thinners like aspirin. When you receive anesthesia, your blood pressure and circulation naturally fluctuate. If you combine that with a medication that affects your blood's ability to clot, you can create a perfect storm for complications, including internal bleeding or disruptions in blood flow to the brain, which can lead to a silent stroke. A 2021 review in the journal Gastrointestinal Endoscopy found a notable increase in mini-strokes among patients 65 and older within 72 hours of undergoing sedated endoscopic procedures. These weren't major strokes, but they were clear warning signs that something had disrupted blood flow to the brain. Think about a 76-year-old woman who had a routine colonoscopy. She felt fine going in. 2 days later, she developed slurred speech and poor coordination. The UR confirmed a minor stroke. Her doctors believed the dip in blood pressure during sedation, combined with her daily aspirin, created the conditions for a clot to travel. Again, this doesn't mean you should refuse it means you must be part of the decision. Ask your doctor to clearly explain why you need it now. If it's just a routine follow-up and you have no new symptoms, ask if monitoring is an option. Always disclose every single medication you take, and ask, do I need to stop my blood thinner for this? What are the sedation risks for someone with my health profile? Now for our fourth test, the MRI with contrast. MRIs are incredible diagnostic tools, but just like with CT scans, the danger can lie in the contrast dye. For MREs, this dye is often good. Gadolinium is a heavy metal that your kidneys are supposed to filter out. Here's the catch: our kidney function naturally declines as we age. If you have even mild, undiagnosed kidney disease, your body may not clear the gadolinium efficiently. Small amounts can linger. This has been linked to a rare but serious condition called nephrogenic systemic fibrosis, which causes thickening of the skin and connective tissue. But there's a more subtle concern. Researchers have found gadolinium deposits can remain in the brain tissue. Some experts believe this may contribute to neurological symptoms like brain fog, dizziness, or confusion, especially in those with pre-existing circulatory issues. A 2019 study in the journal Radiology found that about 5% of patients over 65 who had a contrast MRI reported new stroke-like symptoms within a week. Most of these patients had an underlying, sometimes undiagnosed, kidney issue. So, what can you do? If your doctor recommends a contrast MRI, ask if it can be done without contrast. Often it can. If contrast is absolutely necessary, insist on a simple kidney function blood test called a GFR. It's a simple step that can bring you immense peace of mind. Finally, let's talk about a test that seems completely harmless: the routine carotid artery ultrasound. It's a quick, non-invasive scan of the main arteries that supply blood to your brain. It seems like the perfect preventative test. But here is where a good test can lead to a bad outcome. If this scan is ordered just to check and you have no symptoms, no dizziness, no vision changes, no weakness, it can lead you down a path to a risky, unnecessary surgery. It's normal for arteries to develop some plaque as we age. An ultrasound might find a 50% or 60% narrowing, which sounds terrifying. Your doctor might then refer you to a surgeon who suggests a procedure to clear it out. However, a landmark study in the New England Journal of Medicine followed thousands of older adults with moderate carotid narrowing but no symptoms. The researchers found that for most, surgery did not reduce stroke risk any more than medication and lifestyle management did. In fact, a small but significant percentage of patients actually suffered strokes as a direct result of the surgery itself. The lesson here is profound. If you are asymptomatic and your doctor suggests this scan, ask the critical questions. What are we looking for? And what will we do if we find it? Will this scan actually change my treatment plan, or will it just lead to more tests and anxiety? If you're already managing your blood pressure and cholesterol, The scan may not add any value, and if you are told you need surgery for an asymptomatic blockage, always get a second opinion. So, here's the bottom line. Our bodies are different after the age of 60. A procedure that is standard for a younger person can have unexpected consequences for us. The solution is not to refuse medical care. It is to step into your power. It's to take a moment, pause, and ask questions to ensure every test is tailored to your health needs, not just a protocol on a checklist. Ask, is this really necessary for me? And, is there a safer alternative? Informed decisions lead to better outcomes and peace of mind. Your medical history matters. Your voice matters. I'd love to build a community around this. Have you, or has someone you love, ever had a strange or unexpected experience after a medical test? Please share your story in the comments below. You never know who you might help by sharing your wisdom. Here at Heartful Health After 45, we believe your health journey should be guided by knowledge, not by fear or routine. We're dedicated to uncovering the critical, lesser-known health insights that empower you to live your best, healthiest life. If this video made you feel more aware and in control, please give it a thumbs up, and be sure to subscribe and click the notification bell so you never miss an update. Thank you for watching, and be well.